Good morning all. Today I am going to discuss you regarding supervision. As you know that supervision is a very important topic in nursing management. First we will see the concept of supervision. So supervision has derived from two Latin words, that is super means above and vision means seeing. That means overseeing or superintending the work of others. Thus, supervision is a two-fold process. So, in one side we call it as a guiding process, and the other fold we will call it as a superintending the work of others. Hope you understood. So, next one is, it is a teaching learning process which provide constant observation, monitoring and evaluation, guidance to subordinates to enable them to perform their activities effectively and efficiently, maintaining the required standards. Next we will see the definition. According to Terry, the supervision is observing the subordinates at work to ensure that they are working according to plans and policies of the organization and to help them in solving the problems. So next we will see the objectives, the main objectives of the supervision. To see the combination of the task on time, to promote continuous improvement in the performance. Some of the specific objectives of supervision are to meet the predetermined goals of the departments, to ensure the working of employees according to their job description, to evaluate the quality of care rendered by the staff, to motivate staff to use talents and potentialities, to guide individual staff to achieve their personal goals, to help staff to adjust with the environment, to promote the teamwork. These are some of the objectives of the supervision. Next we will move on to purposes of supervision. Next one is purposes of supervision. So we will see the purposes. The first and foremost purpose of supervision is to accomplish the work, then to evaluate the performance and to provide feedback, to improve staff efforts and individually and collectively, to make subordinates self-directed, to bring a sense of security, to bring a personal and professional growth, to help in solving clinical, managerial and personal problems, to encourage the teamwork, to bridge the gap between personal and organizational goals, to improve the quality of nursing care. These are the main purposes of the supervision. Next one we will see the importance of supervision. Why the supervision is important in a hospital settings. So first importance is to maintain the optimum functioning of each staff and unit. So if a supervisor is there and she is supervising very nicely, what will be happening? The functions will be optimum, and whatever the staff is there in the particular unit, it will be optimum. Then knowledge and skills of subordinates. So a supervisor, she will be encouraging the subordinates to improve their skills and knowledge. Right attitude towards work and co-workers. So a supervisor always she have the right attitude towards the work and the co-workers, best to achieve the goal of the nursing organization. So a supervisor always she will be thinking regarding how to achieve the goal of the nursing organization. Then she will be coordinating the services within the department and organization, and she will develop and improve the nursing standards. These are some of the importance of supervision. And other importance are, a supervisor will formulate the new policies. She will be interpreting the policies and objectives of the organization. She will protect the public by reducing the negligence and errors of the staff nurses. And she will be establishing a good interpersonal relationship. And she will be setting some of the personal goals. She will create a physical, psychological and social environment to work. These are the main importance. Next we will move on to one of the important topic in supervision, that is principles of supervision. So principles of supervision usually ask for 5 marks and very important topic. So it is an ongoing and continuous teaching learning process. As I told in concept, supervision is a ongoing teaching learning process. It is employee centered process. Third principle is it is cooperatively planned and focused on the attainment of the goal. Then fourth one is it should have the objectives, methods and criteria for judging. Then it has a basis on the job description and individual needs of the staff. Then it stimulates the subordinates for their self-development. Supervisor must be technically and academically competent. Then proper supervision respect the individuality of subordinates. So that is regarding the principles of supervision. So in next class we will be dealing with the models of supervision. Hope you are understanding my classes. Please subscribe the channel, share to your friends. Please watch other videos also. Thank you for watching.